discuss what to do. We talked about, Chris Dotson just talked about having flexor pronator injuries. There's an intimate relationship between those flexor muscles on the inside of your elbow and the UCL. So very rarely do I see a player who has an injury to the flexor pronator muscle that doesn't, at least in my mind, somewhat have a concern that he's got a UCL injury just waiting to happen. So even though it may only be, you went to the doctor and the doctor says, oh, hey, it just looks like it's a flexor pronator injury, that should be setting off a red flag to you guys that, that's just the beginning of the problem. It's not just a flexor pronator injury. It's more. If you continue to do what you've been doing and you don't make a correction in what they've been doing, you're going to be seeing him, and he's going to lay you on the table, and then he can cut you open, and he can spend a year doing rehab. It's a progression. Again, on the other side are the extensor muscles. They're active. When you're back in the cocking phase, they're also active. We talked about the back of the elbow, or the lateral side of the elbow gets compression to the joint. Part of that responsibility is what's happening dynamically in that joint for the muscles to try to stabilize it.